Hey everyone, it is Dr. Jorge coming to you on a Wellness Wednesday. So it's late in the evening, and we have just had last week some new information regarding prostate cancer. And prostate cancer screening is very controversial, but I'm going to tell you my opinion and what is generally recommended. First of all, gentlemen, the prostate is that organ that is behind the penis inside of the pubic area. It's somewhere between the scrotum and the anus. I trained in Texas and they call that area the taint because it taint one thing or another. But regardless, prostate cancer kills approximately 27,000 men in the United States. A few years ago, one of the leading organizations recommended not to test for prostate cancer at all in any men because they thought that the harm was worse than the actual good that it did. All right, that never made a lot of sense to me. I personally, unless it is overwhelming evidence, really hate when big governing bodies try to save money and not individual lives. Lord knows that I've had enough patients who are not supposed to have had prostate cancer. They were younger than 40, and indeed they had it, and it was diagnosed due to a simple rectal examination and a PSA test. Well, again, just as happens in science, this organization came out a couple of weeks ago and said, actually, they changed their recommendations from a D category to a C, meaning that no longer did they feel that it was more harm than good. They thought that this was something individualized that each man should discuss with their physician. You know where I stand on this. I think that every man over a certain age, definitely over 50, should have both a rectal examination and a PSA test. The test just costs a few dollars. You know, even if your insurance doesn't pay for it, I suggest you spring for it. My friend Whoopi Goldberg, who I did a radio show for many years, and used to have a saying, and a friend of mine, Michael Pelka, who I sometimes do his radio show called True Pelka, reminded me that Whoopi used to say to gentlemen who didn't want to have a prostate exam, shut up, bend over, and live. In other words, a simple test could save your life. Discuss it over with your physician. See if it's right for you. Don't let the fear of a rectal examination or a blood test cost you your life. It's something that you should know about. It's something that you should not be shy about discussing. And in my opinion, it's something that you should do. All right? Be number one, gentlemen. Take care of yourselves. Until next week, this is Dr. Jorge signing off for Wellness Wednesday. Adios.